Hey everyone, how's everyone doing? Welcome. We're very excited to have you tonight to talk about our board prep and series and how to prepare for your board exams as busy residents. So my name is Eric Barnett. I'm a tutor here at MST. I'm going on about 6 years here. I'm also a board certified internist. I work as a hospitalist, and this is Anne. So Anne, why don't you introduce yourself?
Hi, I'm Anne. I've also been tutoring for about 6 years. I am a board certified pediatrician, now PICU fellow.
Awesome. Yeah. So we're, again, like we said, we're really excited to have all you guys here and sort of walk you through how to prepare for your board exams. So let's get started. So just to start off a little bit, who we are at Med School Tutors. We're a very passionate group of residents, attendings, fellows who are here to help you guys with your board exams. And we tutor a variety of board exams from med school through residency and beyond residency in terms of advanced boards. So it's a one-on-one tutoring. So you're actually paired with a tutor who is dedicated to your personal success. And again, it's through pre-med through residency and beyond. We've been doing this for a very long time. Like Anne and I said, we've been here for about 6 years, but Med School Tutors has been around for about 15 years. And we're very, very good at what we do, which is why we're still going strong. And all of our tutors are, again, very passionate, very dedicated, and have done really, really well in their board exams, and they want to help you guys do the same. So a little bit about what we're going to talk about today, just in terms of an outline. So we're going to tell you the best ways to study during residency, because we all know that residency is a super, super hectic and busy time. So trying to find time, dedicated time to study for your board exams is tricky. So we're going to tell you about some timeline tips and finding and creating study time. Again, you're very busy and your primary focus is going to be on being a resident, being a doctor, learning to be the best physician you could possibly be, but also trying to find some time to make sure that you're getting studying in so that you can crush your exams. And using your in-training exams as a guide. You know, you're all going to be taking in-training exams, and depending on your program, maybe that's once. Sometimes they have you take it 3 times. You know, every year, at least for internal medicine, and using that as a guide to help you model your study behavior after. Then, because Anne and I are both, I'm an internal medicine physician, Anne's a pediatrician, we're going to talk about specific resources for each of our specialties for those types of board exams. And at the very end, if you guys have any questions about what we talked about, we're going to have a live question and answer session. So, Anne, why don't you take us through some general tips about how to go through studying?
Perfect. And so this is going to be kind of independent for kind of all specialties. So really your studying for the boards should start in your first year of residency, and you shouldn't wait until after you finish to start studying. First thing, adjust your expectations. You are not going to have that much time to study while you are a resident. It's just not going to happen, and that's totally fine, especially the first year. But you do want to try to make time when you do have time, but just adjust your expectations. It's not like step one where all you're doing is studying all the time. Start preparing for the boards early. You don't want to wait until the last few months of residency, just like we kind of said. Limiting your resources, kind of like when you were studying for all your step exams. If you choose too many resources, it becomes really overwhelming, and then you kind of just don't use any of them. So really trying to stick with the key ones for your specialty is really important. And then the most important thing is using your lighter rotations to do the bulk of your studying. So these are like your electives, your research blocks, your outpatient blocks, and taking time to actually do a little bit of reading and studying as much as you can during those easier times. Eric, anything you would want to add?
Yeah, I think that's all super important. And again, it's adjusting your expectations is super important because, you know, like Anne was saying, you know, for step one, that was your job, right? Your primary job was to study for step one, and that's all you had to do. Residency, you have a primary job and then studying on top of it. So some quick study tips for the question banks, because again, just like with USMLE, with MCAT, your board exams are going to have specific Qbanks as well. So try and, again, utilize your time to your advantage because you're going to be very busy on the ward. So try to group your questions and your readings for particular patient cases. So if you're on, let's say, a cardiology rotation, that's going to be the time to be focusing on cardiology. And you don't even have to do like a full, read everything about cardiology. For instance, would focus it on specific patients. So if I admitted a patient with decompensated heart failure, that was a great time to read about the diagnosis management of acute decompensated heart failure, because you're killing two birds with one stone. And that's key for residency, is if you can do multiple things, it's in a single sitting, it's actually really beneficial. And again, try grouping your study and readings according to the rotation that you're on. So if you're in the ICU, that's when you're going to be studying about ICU medicine. You don't necessarily have to read about outpatient medicine and things like that if you're on an ICU rotation, and vice versa, because again, you'll be able to get the most out of it. And then it's also important to note, again, you know yourself as a student by this point because you've already taken lots of exams. So if you've had prior failures in the USMLEs, you may want to start again very, very early and have a longitudinal study plan about what you want to do. So and that's how it is in internal medicine. I'm sure, Anne, it's pretty similar with pediatrics.
Yeah, and I think it would be the same pretty much in any specialty. And not only will this help to make the information stick a little bit better if you're on that rotation, but it should also help then taking care of your patients. If you're reading and practicing more, it's only going to make you better clinically as well, because that is super important as well. Yes, we're talking about studying for the boards. We also want to be a good clinician. So this goes hand in hand that way.
Absolutely.
So a word about the ITEs, which I think pretty much every specialty takes these. Those are your in-training exams. And each year, I think during fellowship or in residency, you guys will be taking one. And the nice thing is that each year it kind of will bring different things to focus on as you kind of get further along and you've been starting to study along. Each in-training exam will give you a score report that will give you an absolute score. It will compare you to how you did nationally. And I think they also usually will tell you how your program did as a whole as well. And what it will tell you is for each kind of subject area, just like MBME, is like how you compare. So how do you do in cardiology? How do you do in endocrinology? And it will show you which ones you're strong in and which ones you're particularly weak in. So in first year, the really important thing is a lot of times these happen pretty early in the year. And so it's not like you're going to be studying specifically for this in-training exam. It's really just going to be, you go in blind and it's going to tell you what you know and what you don't know. And so then it's really helpful being like, well, I did okay with this. Like I should still study this, but I'm like really bad at these cardiology questions. I really need to put in more time here. So the first year is really great for kind of really figuring out your red flags. In the second year, you're studying more. You probably will do a little bit of prep before you go into this in-training exam. And so at this point, you should have started to address some of the gaps that you see. And as you've addressed these gaps, you're going to learn that there are new ones that are going to come up. And so you're going to keep progressing that way. And then for third year, I really used my in-training as am I on track to passing my boards? And so it was really helpful to see this of like, yes, and to continue, or if you weren't, to be like, okay, well now I really have to like put myself into high gear and really make a study plan for the test based on how I did on this in training. So Eric, anything you would add there?
Yeah, and I think that's the in-training exam is good. It's usually low stakes when you're actually taking it because your program isn't going to, say, oh gosh, you didn't do well. Now there's hell to pay, but it's a good structure for you, and it gives you an idea of like how you're going to do it. Sort of like a prognostic and a diagnostic tool. It helps you diagnose your weak areas, but it also can prognosticate how you're going to do for the boards. And most programs use them as a way to sort of help provide you with any additional support if you need it during residency. So that sort of brings us to maybe some warning signs to look out for, because again, sometimes it's a little hard in the middle of residency when you're so busy to identify, oh, I'm struggling with this area. I really should focus on it when you're, working 80 hours a week. So if you've had again, like I said, you know yourself the best by this point in terms of the type of test taker you are. So if you've struggled with standardized tests before in the past, you have issues with timing or test anxiety, the board exams, the advanced board exams aren't going to be much different in that regard. They're still going to have those same stressors that stress you out. So it's good to know in advance when you start residency, say, okay, I know these are particularly historical issues for me when I take board exams, so I should start working on them early. If when you're a PGY2 or PGY3 and your in-training exam is below the 25th to 30th percentile, that should trigger a little bit of warning, because that's usually the cutoff a lot of programs use, where they're saying, okay, we're concerned that you may not pass the boards if you're not getting above this certain level. And if you're if you have like a lack of familiarity with certain concepts in conferences or on the wards compared to your peers. Now, again, when people start residency, they're going to be starting at different levels. People are going to have strengths in cardiology, and people are going to have strengths in palm crit. But as you progress through residency, that's sort of the great equalizer, where you should all be getting the same experience and all being caught up to speed eventually as you progress through your PGY years. So if you realize like, oh my gosh, I've been really like every ICU rotation I have, I struggle. That's a sign that, ICU medicine, crit care medicine, pulmonology are some things that you should be focusing on, putting a lot of effort in. And also, pay attention to your evaluations. When you're on wards, whatever rotation you're on, you're going to get evaluations. Really pay attention to that. Some people, sort of just check their evaluations twice a year when they have to meet with their program director or their faculty advisor. But after every rotation, take a look at your evaluations. And if there's any things that are concerning about your performance, about the way you are in rounds, and they'll often comment on your medical knowledge, and that's what you should focus on. If they say, weak medical knowledge, that's something you say, okay, well, how can I improve upon that? And also just asking your attendings and your program director, your associate program directors for feedback, and getting that constant feedback will only help bolster you and help you prepare for these exams. Anything to add, Anne?
No, I totally agree with all those. That sounds perfect.
Awesome.
Okay, so some common mistakes to avoid. I think the first one is like the most important thing. So don't wait until the end of PGY3 or post-residency to start studying. Like really, this is something that you should be starting as a PGY1 to start studying and have kind of a plan of how you're going to progress, whether that's through reading about while you're on rotations, doing questions while you're on rotations. Like you need to start at the beginning just because of how busy you're going to be. Going along with that is don't take on too much too fast. So in first year, you don't need to like buy the whole Qbank and get through the whole Qbank. Like that's too much too quickly. You want to pace yourself because we know that you're not going to have as much time. And so spreading it out is the best way to do this. And then the last one, don't be too hard on yourself. This is not easy. Trying to study for a test while also working. And then when you probably take your board exam, you're going to be a full-time physician somewhere. And it's really hard to try to find the time to study. And so sometimes you have to give yourself a little bit of slack, and that is okay. And some days you're going to have more time, and that's great. And you're going to study then. And some days are going to just be too tough. And you're going to be like, I meant to study and I can't. And that's okay too. This is hard, and that's totally okay.
Yeah, absolutely. And I think that's the hardest thing, is sort of being forgiving of yourself, because you may have the grandest plans to say, okay, I'm gonna study, I'm gonna do, a bunch of questions, I'm gonna read a couple of chapters, but you have a bunch of sick patients and you get out of work 2 hours late, and when you get home all you want to do is eat dinner and go to sleep. And that's okay. That's super important, because if you're not taking care of yourself and your emotional and mental well-being, you're not going to do yourself any favors by trying to force yourself to study for an additional 2 hours at night. So again, and make sure, like, when we said earlier, adjust your expectations, because sometimes it may be like when I was taking the subway into work in the morning, I'd do like 10 questions on my phone, and that was my studying for the day. It's not going to be like step one, where you're going to be cloistered in a library for 12 hours and get all that time to study. So again, be forgiving of yourself if things don't go according to plan. So this is sort of now getting to the final year of residency. So you've made it to your last year of residency, your big bad third year or fourth year, however long your residency may be. So you should have a sort of a plan going forward in the starting the winter of your third year, as the third year starts to wind down. Knowledge is power. Don't be afraid to assess where you are, to get your baseline starting point. Make a calendar. So again, that may seem really basic, but it keeps you on track. It keeps you accountable, because if you don't keep track of this, it's going to just get lost in the fray of your residency. You're just going to be going from rotation to rotation, and you're going to forget about studying if you don't have it as a set calendar. And again, it's adjustable. It's something that's very dynamic. It doesn't have to be static, but just have something as a framework to say, okay, today I should be doing some cardio questions. And again, be realistic. You're not going to have a whole lot of time if you're on an ICU rotation, or you're on a very, very busy ward rotation, you're on a COVID unit. You're not going to be able to say, okay, I'm going to have, all this time to study. So when that rotation's coming up, you said, all right, that's not going to be a very busy one, but I have elective and I'm just going to be doing some research. I'll have more time to study. I'll have a more leisurely schedule to do all that stuff. And, set aside some time to select and purchase your study resources. And we'll get into that in a little bit about what type of resources are good for at least internal medicine and pediatrics. But again, it's getting a good core group of resources and not spreading yourself too thin. And again, communicating with your co-residents, because they're going to have plans, people who just graduated or who had just taken their exams, what worked for them. And even your recently graduated attendings, when I graduated, I became a hospitalist. So I actually had residents who I was co-residents with, and now we're the residents who were working with me on service, said, hey, how did you prepare for your boards? What did you do? And, solicit all of their advice as well. But remember, just like with anything, take everything with a grain of salt, because, what works for some people doesn't necessarily have to work for you. But again, this is all pretty par for the course, and should be starting to have your wheels turning when you're a third year. That's how it worked for me. I know if Anne, that's how it worked for you when you were a third year.
Yep, totally. And I think for each specialty, there will be kind of those like go-to resources, like just like there's step one, like first aid, right? And like UWorld questions, like there will be kind of those go-to that every kind of specialty has. And so those are kind of going to be the main ones that you're going to use. And that will come from like talking to people who have taken the test.
Yes.
They'll be able to tell that to you. So just really quickly, some like PEDS specific resources, because I know probably not everyone here is taking the PEDS exam, but just quickly, some things that you should have kind of in your back pocket. These are kind of the go-to resources for PEDS. In first and second year, the two big things to use is the Pediatrics in Review, which is something that the AAP will mail you in the mail every month. That goes over all the topics that will be covered on your prep on the board exam. So actually all the topics in these 3 years that you get are covered on your board exam. And technically things that are not covered in these issues are not really supposed to be on your board exam. So reading these is really important and going through them kind of each month when you get them, or you can do it kind of reading about it with your patients and you're like, I'm on cards, I'm going to go and find like the cardiology, like congenital heart disease article. And then the same thing is this prep, which comes through the AAP as well, which is 250 question tests that it's really helpful to just do 5 questions a week. It will get you through the entire test in a year and to kind of do it gradually through each year. Third year, when you're really trying to hunker down, is when Med Study becomes really useful. That's the main Qbank that everyone uses. They also have a book, which is kind of your like first aid Bible for the pediatric boards. If you like books, if you're kind of just a Qbank person, then Med Study alone is great. And then if you're a flashcard person, those are really thorough as well. And then post-residency, really the big thing is just doing questions. And then there's also a secret ABP practice test through the portal that you should definitely do that not very many people know about. Eric, why don't you tell us about some of the internal med ones?
Yeah, of course. So just like with any board exam, there's going to be lots of different resources to choose from. Personally, and I think this goes for a lot of internal medicine residents and fellows and attendings, MixApp is probably one of your best resources. It's an online resource and it's also an in-print resource. A lot of residency programs provide MixApp, at least the question bank component of it, and the online text version of it. But it's over 1,000 questions and has all the text incorporated, and it breaks it down by organ system and discipline. So if you have a specific area of weakness, like arrhythmias, you can actually just type in arrhythmias and it'll give you the arrhythmia section and any associated question with it. So you can really just specifically test your knowledge. You can make up tests and quizzes to help you. And the mobile app, I think, is indispensable because that's what I would do on my ride to and from work. Or even if I had like some downtime or if I was waiting for an admission on a call day, I would just do a couple of MixApp questions on my phone. Again, there's a couple of other ones. The New England Journal of Medicine has a Knowledge Plus series that actually is pretty good. it's again additional questions that you want to augment, because I know a lot of people go through questions really quickly. They may very well go through all their mix-app questions a couple of times through residency, and as they're getting ready to prepare for the exam, may want an additional set of questions. The New England Journal of Medicine Knowledge Plus series does that. UWorld, again, there's some UWorld questions, and I think they're pretty good. When compared to mix-app, I think they're not as good. But again, people like having tons of questions to go through, and like Anne was saying, questions when you're getting ready to take your exam. Rosh Review, Med Challenger, and TrueLearn are some other resources that you can do. And I think the best way to sort of assess which ones are best for you is sort of ask around and see what your fellow residents and recently graduated residents had done. And also you can just look them up online and see their reviews. The most common ones are the top three. So mix-app, New England Journal of Medicine Knowledge Plus, and UWorld are some of the more popular ones. And, you know, MST and your best results. Like we said, we love what we do. I think Med School Tutors does a phenomenal job of just hiring these tutors who are so passionate about teaching, about medicine, and about your success. And really what's unique about this is you get a one-on-one tutor who's dedicated to your success. They help you not only evaluate your areas of weakness and work on them, they help you with scheduling, they help you go through questions, and really are your personal cheerleader to help you succeed in every way possible. They help you with custom study schedules. Again, we know that every student studies a different way and learns a different way, and it's not sort of just a boilerplate schedule that you get for everyone. They work with you one-on-one to create the schedule that's going to work best for you. And it's very adaptive, content and assessment review, performance tracking. Again, regular communications between sessions. I know from my personal experience, I give my tutees my number. So if there's any questions in between sessions, all they have to do is text me. They can email me. Again, very accessible. I take my job as a tutor very seriously, and I know Anne does as well, and all the tutors here, because it's, again, a very big passion of ours. Accountability, mentorship, support, and guidance. I think accountability is the biggest thing as well, because sometimes it's hard to sort of, you know, when you're busy, whatever stage of your medical career you're in, sometimes it's hard to sort of stay on track, but that's what your tutor's there for. They're there when you're meeting with them for 2 hours, an hour, however long you're meeting. That's just dedicated time for you and your tutor to go through the material and help you. And again, we offer one-time strategic planning sessions, as well as in-train exam tutoring as well. So, you know, as we're wrapping up, I'm gonna try to pull up the chat function.
And it looks like there's one that I'm seeing. And then if other people have questions, please type them in. But a couple people have asked the importance of the actual board score, and if the actual score itself matters, or if passing is the only thing that matters. Which I can at least say for pediatrics, and I think is the case for most of them, that the actual score does not matter. It's more just about passing. And that holds true. Somebody asked if like fellowships care, and I have not seen that fellowships have cared about passing, that it really, or like the score, it's really just, did you pass or not? And so I think that's usually the most important thing. But Eric, correct me if I'm wrong, if that's different in internal medicine.
No, it's exactly the same for internal medicine. It's just a binary. Did you pass and now you're board certified, or did you fail? And again, jobs, fellowships, they don't look at your actual raw score. They just want to see that you are a board certified physician. So yeah. And I can't see the chat. So Anne, if any other questions pop in, feel free to read them out.
Okay, I see another one. Do you recommend taking time off in between residency and attending life to study? I can speak personally to this. I did not, since I went straight into fellowship. And I know some people who took time before they actually started their job and studied, and other people, you just make do with it and you're in fellowship because that's just how your life plan ends up. And either way, it is fine. You will be fine whether you're trying to study while also trying to work as a fellow. You will be fine if you are working in an outpatient clinic or as a hospitalist and trying to study, or you'll be fine if you do take time. I think it really kind of will depend on where you are, right? So like if you have been struggling more with your in-training exams, if you know that historically you've struggled with your like step exams, then it may actually be something that you would want to consider to actually take some time, but I don't think that is necessary for every person, and kind of would be a personal thing and something that definitely either talking with friends, people who've gone through it, but also MST is here to help you kind of decide if that is something that would be helpful or not. But I don't think necessarily like everybody should take off time in between residency and starting an attending job to study for the board exams.
Yeah, I definitely agree. It's definitely a personal choice. And when you're with fellowship, it's a little bit more inflexible because your schedule's sort of set. They have your rotations, this is what you're going to be doing. If you go right into general medicine, or you're in attending and or general pediatrics, or a hospitalist job when you graduate, your schedule may be a little bit more flexible and you're allowed to sort of negotiate some aspects of your schedule. A lot of hospitalist jobs have a 7 on, 7 off schedule. So a lot of people may schedule their 7 off around the time they're going to take their exam, and use their weeks off to actually study. And then when they're on, they're on. And again, when I graduated, I became a hospitalist, and I was working for 2 months before I took my board exams. But again, I still use that strategy of, okay, I'm admitting a COPD exacerbation. Let me go over. And by that point, I already sort of knew which areas I was weak in, because I didn't see a lot of outpatient rheumatology as a resident. So I knew those were the things that were coming up often. So, when I had some downtime, I'm going to read about how to manage gout. I'm going to read about how to manage lupus, outpatient lupus. Of course, as a resident, I saw like the craziest cases of, lupus, pericarditis, and these really, rare complications of those. But, if someone came in with like one joint that hurt, I was like, oh gosh, what do I do? So those were the times where I was like, okay, that I know is a little bit of a weak spot for me. So again, it's you don't necessarily need that time off, but when you become an attending, your schedule may allow for some time before your exam to study.
Perfect. There's another one. Is there a good way to retain the stuff you study during residency? And I think the biggest way to do it is kind of how we've been talking about it, like reading and studying about the patients that you're taking care of. I think it just makes it stick a lot more if you can be like, oh, I took care of this patient who had lupus pericarditis, and and then you read all about lupus, but you can apply it to that patient. I think it's really helpful to really retain it if you can apply it to kind of people that you're seeing. So that was how it helped me to kind of stick it a little bit more, was actually studying things that were pertinent. I think it could be a lot harder if you just decided I'm going to read through the books cover to cover. I don't care what rotation I'm on. I think that would honestly make it a lot harder to retain the information.
Yeah, I think that's absolutely right. Because if you really remember how to manage ARDS, if you're in the ICU seeing nothing but ARDS every day, that really helps it stick, because you're reading about it and seeing the sort of nuts and bolts and formal way of managing it, and then you're doing it in real life. So that really helps it. And again, just repeating it and keeping it going, and making sure that you have enough repetition and go through it. Again, that's why starting it early is really key, because it's very hard to cram 3 years of a specialty into 2 months of study. So if you start early and keep doing it, and because again, you're going to have multiple ICU rotations, multiple cards rotations, multiple general medicine rotations as you go through residency. So when you keep going through that material over and over again, it really does stick.
I don't see any other questions right now. So thank you guys so much for coming and joining us. I think hopefully the big key points that you guys got out of this is that really starting early is going to be in your best interest. And I think also one of the biggest things is not being hard on yourself, and making sure that that there will be time to study, there will be times when it's going to be too busy, and that's okay too. We are here to answer any questions that you guys have, us and everyone at MST headquarters. And Eric, any final thoughts on your end?
No, I think you hit the nail on the head. It's just a matter of starting early and not getting too inundated. And again, be forgiving of yourself, because residency is it's a lot of work. It's a lot of fun, but it's a lot of work as well. And you have to sort of go with the flow and find time when you do have time to study, and take care of yourself as well. And again, having a sort of a one-on-one tutor to help you along the way definitely makes all the difference. So yeah, but we wish you guys the best of luck in your journey and wherever you may be. And thank you for joining us tonight.
Yeah. Thanks, guys.